Hello everybody and welcome back to another episode of Nursing Surgery Day 9. In today's episode, I, your nurse Haiqal from Group 26, will be explaining to you the examinations as well as the notification of myocardial infarction on our patients. Before we get into all of that, we need to know what is myocardial infarction in the first place, ladies and gentlemen. An easier understanding of myocardial infarction is also known as a heart attack, which is what everybody else uses if they do not know the medical term myocardial infarction. So, a myocardial infarction or a heart attack is when one or more areas of the heart muscle they do not get enough oxygen supplied to them. It actually happens when blood flow to the heart is blocked or restricted to reach the muscle. Simply saying that when a heart muscle or heart muscles, a few of the heart muscles, do not get enough oxygen supplied to them from our red blood cell, a myocardial infarction will occur. As we all know, ladies and gentlemen, generally, even if you're not a medical student, you know how deadly heart attacks can be. And heart attacks have been one of the leading causes of death in multiple countries in the 21st century. Hence, that is why we must be alert as well as vigilant of the signs and symptoms present in our patients who are at risk of myocardial infarction. Thankfully, for us nursing assistants, there is an acronym for us to remember the signs and symptoms of myocardial infarction on our patients. The acronym is crushing. We will begin by explaining the letter C in crushing, which stands for chest pain. The chest pain in a myocardial infarction is intense and heavy in nature. I will now show you a demonstration on an example of a scenario where we would see a patient who has the symptoms and signs of myocardial infarction. Knock, knock, knock. Hello, my name is Haiqal and I am the nursing assistant on duty today. What seems to be the problem today, miss?
I have chest pain. It's very intense and heavy.
Now we have determined that the patient has chest pains. The next sign and symptom, according to our acronym crushing, is R. So the letter R stands for radiating chest pain. That means the intense and heavy chest pain that our patient experiences does not just stay at the chest, but usually that pain would radiate towards their jaw, their left arm, as well as their backside. Now, miss, could you please describe the intense and heavy chest pain that you said just now?
It's like radiating on my chest. It's always on my left arm. Very few times it's on my jaw. And then yesterday, it was on my back.
Understood, miss. Now we know that the patient's chest pain radiates to her left arm, her jaw, as well as her backside. The next alphabet for us to determine the sign and symptom of myocardial infarction is U. So the letter U stands for unrelieved by nitroglycerin or rest. Now, miss, have you ever been prescribed anything before this for your chest pain?
Yeah, I've gotten nitroglycerin tablets. But they've done nothing.
Understood. Were you doing any hard work when the chest pains occurred?
No, I was just resting.
Understood, miss. Now, the next alphabet will be S. And S in crushing stands for sweating. But we remember that the patient, even though is sweating, they would feel cold and having chills. So, miss, I see that you are sweating, but you are wearing a hoodie. I know that the hospital can be cold, but do you feel cold most of the times?
Yeah, very cold.
So you feel chilly and cold, but you also sweat at the same time?
Yeah.
The next alphabet on the list of crushing is the alphabet H. So the alphabet H would stand for hard to breathe, or also known as shortness of breath, SOB in medical terms. So the patient has a hard time breathing as well as shortness of breath because of the pain from the myocardial infarction. Miss, have you ever had a hard time breathing when you had those chest pains?
Yes, I actually thought it was my asthma at first. Then when I used my inhaler, it didn't work.
So even though you use your inhaler because you have asthma, when you had those chest pains, it didn't go away. Is that right?
Yeah.
Now, the next three final letters of the acronym CRUSHING to help us identify the sign and symptoms of a myocardial infarction in our patient would be increased heart rate, blood pressure, or irregular heart rate. That is the I that we can see from our monitors that show out the vital signs of the patient. Next would be N, that stands for nausea and vomiting in our patient. And last but not least would be G, where the patient is going to be anxious or scared. Miss, could you tell me please, throughout the time where you started noticing your chest pains, have you ever felt any nausea or even vomiting?
I have vomited 3 times and I've always felt nauseous. And lately, I feel like I've been getting very anxious all the time.
Understood, miss. Now, ladies and gentlemen, you have successfully learned all of the signs and symptoms of a patient that has myocardial infarction. However, there are 2 exceptions when it comes to the signs and symptoms of a myocardial infarction. The first exception, ladies and gentlemen, will be for women themselves. This is because there is a majority of women who do not feel the heaviness on their chest at all, even though having myocardial infarction. This is where they feel shortness of breath, pain, but in the lower chest area, not the upper chest. Last but not least, they would have extreme fatigue. And this would not always, but usually result in women thinking that it is just a normal illness, and commonly they mistaken it for a flu, thus resulting in lower and even later treatment for them, which is something not ideal in terms of treating the myocardial infarction. The second exception towards the sign and symptoms of a myocardial infarction in our patients would be called a silent myocardial infarction. The silent myocardial infarction most commonly affects diabetics. This is because those that have diabetes would have something called a diabetic neuropathy. Without going into much detail, essentially having diabetic neuropathy means that the nerves that feel pain in our chest would die, essentially not feeling any pain. This is where the main characteristic of a myocardial infarction is feeling pain. However, those people that have diabetic neuropathy cannot feel the pain, ladies and gentlemen. Hence, they are called silent myocardial infarction. Therefore, ladies and gentlemen, you have just learned about what is myocardial infarction as well as the sign and symptoms of myocardial infarction through our acronym CRUSHING, and as well as the 2 exceptions to what the sign and symptoms of myocardial infarction, so that we can give better care towards our patients, whether it be a male, a female, or even a diabetic, in hopes that we give the best form of healthcare towards them. And with that, ladies and gentlemen, remember to share, like, and subscribe to the video, as well as hit the bell to be notified whenever we upload. And with that, see you in the next episode.